Hey everyone, welcome to the Front Row with Ed. Today we're going to talk about the leading cause of lower back pain in adolescents and children is a spondylolysis, which is a stress fracture that happens 90% of the time at this last lumbar vertebrae right here at the L5 level. Okay, so let's first get some terminology straight because there's a lot of words that sometimes get confused. So let's talk about that first.
It's important to understand the different meanings of these similar sounding words. A spondylosis is an age-related change of the spine, usually osteoarthritic. Spondylitis is just an inflammation of the vertebral segment. A spondylolysis is a fracture of the vertebrae, usually at the L5, and that's the focus of this video. And a spondylolisthesis is an actual slipping forward of one vertebrae over the other that usually requires surgery.
So now that we have the terminology straight, in this particular video I'm talking specifically about a spondylolysis. A big factor in stress fractures of the lumbar spine and lumbar spine pain in general is an increase in the anterior pelvic tilt. So this is a posterior pelvic tilt and this is an anterior pelvic tilt. And I'm going to demonstrate. So what we want to do is we want to avoid an excessive anterior pelvic tilt because you can almost visualize that when I have an increased anterior pelvic tilt, there's a ton of shearing stress that's placed right on this lumbar spine, and you can literally have one vertebrae that starts to kind of slip forward on another vertebrae, and nothing good happens with that. So what does it look like? Take a look at me from the side here. Ideally, you want to try to be nice and level through here. So I'm going to accentuate what an anterior pelvic tilt looks like this. So what happens is you're going to see that drop here. There's going to be, if I have my shirt off, you can tell there's an increase in this arch, increased lordosis of the lumbar spine, but you got this anterior pelvic tilt. So what we want to try to do is we want to try to strengthen up the lower abdominal muscles that are responsible for creating a posterior tilt. Because what we really want to do is we want to try to keep that lumbar spine level, keep that fruit bowl from spilling out, okay? We can think of this as a bowl. And when this bowl is too far forward, the bowl spills out. And we don't have any fruit. So you want to make sure that you try to keep that pelvic floor contracted, the lower abdominals contracted, and level off that pelvis. Let's talk about some specific things that increase the anterior pelvic tilt. So first of all, we're going to go over some foam rolling, then we're going to talk about stretching, and then we're going to talk about strengthening the muscles that are responsible for helping to keep us in that posterior tilt. Let's get to work.
Tightness of the quadricep muscles, specifically the rectus femoris and the TFL, can cause an increase in the pelvic tilt. So make sure that you foam roll the outside, the inside, and the top of both legs. I usually recommend 8 to 10 times in each direction and then another 30 seconds over any particularly tender spot. Usually the outside of the thigh is much more tender. The next area you want to foam roll is the Latissimus dorsi muscle, which inserts on the inside of the shoulder but attaches all the way down at the lumbar spine. You can also bring your top hand, and that gives you a little bit of a lateral stretch of your thoracic spine as well. But it's great to roll that out. How cool is that? We have a couch in our clinic. Anyway, after you're done foam rolling the quads, it's time to give them a stretch. So I'm going to show you two ways. This is one way you can do that. Make sure you keep that lumbar spine stable. So contract the lower abs and slowly drop the support leg until you get a stretch. The next way to do it is to also take a knee and to come forward there. You can also play with your dog while you're down there. That'll give you a nice stretch along the front. You can reach back if you want to go next level and get a nice stretch through the quadricep as well. You can rotate a little bit, and you'll notice that gives you a little bit of a change in the angle of the stretch along the quadricep muscle. What I also like to do here is after I'm done stretching there, I will then rock back into a hamstring stretch. So let's try to repeat the stretches 3 times on each leg for about 30 seconds. However you want to do that is up to you. I just wanted to give you a couple different options. Remember to keep your lumbar spine stable and don't spill the fruit. We're going to get into the strengthening exercises, and the first one is just a simple bridge. If a two-legged bridge is too easy, then you can go to a single leg bridge. It's my dog Romeo. So what you want to do is we're looking for 3 sets of 10 with about a 5-second hold. Like I said, you can go to single leg bridge. If you go to the single leg bridge, it's 2 sets of 10 with about a 5-second hold at the top. Remember, you've got to keep the lower abdominals nice and tight and that lumbar spine in neutral. Avoid that excessive pelvic tilt. Now we're going to go right into the side plank. I want 3 30-second holds of the side plank. You can always go down to your knee if it's too hard, or lift your top leg if it starts to get too easy. Now we jump right into the front plank, and that's not the best front plank. I'm not quite as rounded as it looks, but I'd like 3 30-second holds on the front plank. Next, we're going to do an alternating arm and leg with a 5-second hold. This is going to be 2 sets of 10 with a 5-second hold, once again keeping that spine stable and neutral.
So let's quickly summarize what we learned today in the video. Number 1, we have to avoid an excessive anterior pelvic tilt. The way we do that is by learning to contract our lower abdominals, level off that fruit bowl, and get stronger through the rectus abdominis as well as the obliques. We talked about the exercises that you can do to help that. The second thing is, if you have an adolescent or a young child that has persistent lower back pain, I recommend getting him checked out, take an x-ray, just to rule out that stress fracture. Because remember, spondylolysis is a leading cause of lower back pain in adolescents and children because this spinal column, this vertebral column, does not completely ossify until they're about 25 years of age. So if there's any questions, please let me know. Leave a comment down below. Hopefully you learned something, and thank you very much.